All right, good afternoon, everyone. Thank you for being here in person or on the phone. Last night, in the midst of this pandemic, we saw another horrible example of Philadelphia's other public health crisis, and that's gun violence. 5 people shot, including an infant and a 14-year-old. This is horrible by itself, but the fact that it comes as the impact of this virus is felt in every neighborhood of Philadelphia is even more gut-wrenching. We need everyone to come together to stop gun violence all the time, but never more so than right now. In times of crisis, we need the community's help more than ever. We, government, our residents, and our nonprofits must be united in our response to COVID-19 and in our response to gun violence. I want to make it clear. Police are still enforcing the law. If you are committing gun crimes, you will be arrested. It's that simple. Put the guns down or face the consequences. Commissioner Outlaw has joined us here today in case reporters have questions on current operations. She has directed her officers to continue their enforcement of the city's stay-at-home order. This enforcement will consist of warnings, and the officers have discretion to issue citations. Others can help as well. We are calling on the district attorney to vigorously enforce all firearm-related charges during this time of crisis. It is imperative that we send a clear message. Gun violence will not be taken lightly. This is a message the DA can reinforce in his office's handling of all such cases going forward. There needs to be some consequences for carrying a legal gun in Philadelphia, especially if you're a convicted felon. There should be a consequence. We're all about criminal justice reform, and we've been doing that for the last 4+ years. But in this particular time of crisis, if you're carrying a gun illegally, you need to be locked up and kept there. There are some things we all Philadelphians can do. If you or someone you know needs support because of the potential of violence, contact the Community Crisis Intervention Program at 215-800-4611. That's, again, 215-800-4611 for Community Crisis Intervention. If you see something, say something. You can report criminal activity anonymously by contacting police at 215-686-TIPS, 686-TIPS. For law-abiding firearm owners, please keep your weapons safely locked. And if you need a gun lock, you can contact the sheriff's office. If your firearm was stolen, report it to the police right away. We've been working tirelessly to stem the flow of illegal guns in our city. Join us. Make sure your voice is heard. Call your state and federal lawmakers and demand meaningful gun reform. In the meantime, we must stay home, wash our hands, and practice social distancing in order to save lives. And let's do our part for the health professionals working every day, fighting for us by putting the guns down so they don't have to work on you and they can work on people with the virus. We want to make sure these brave men and women have every hospital bed, ventilator, and resource they need to keep fighting this virus. This crisis has made the acronym PPE for personal protective equipment known far and wide. The city's Office of Emergency Management, led by Fire Commissioner Adam Teal, has been working day in and day out to procure PPE for our first responders and the medical institutions in the city. But nationally, the question of insufficient supplies in hospitals has led to the very real concerns about the rationing of care. We were pleased to see that the Office for Civil Rights at the U.S. Department of Health and Human Services just issued a bulletin to ensure that health care provided during COVID-19 remains free from discrimination. The bulletin reminds providers that discrimination in HHS-funded programs is prohibited, including the provision of health care services during COVID-19. That would apply to any discrimination on the basis of race, color, national origin, disability, age, sex, and exercise of conscience and religion. The Office of Civil Rights is particularly focused on ensuring that people with disabilities don't face discrimination when decisions are made about their treatment during the COVID-19 health care emergency. This virus does not discriminate. It is affecting everyone, no matter their age, race, national origin, ability, sex, or religion. So let this be an important reminder to residents of the city and this entire region. No one, even residents who are undocumented, can be discriminated against when decisions are made about their care during this pandemic. Now I'd like to ask Dr. Farley to give us our daily update.
Thank you very much, Mayor. Just brief updates today. Overall, you're seeing a continued growth in cases of coronavirus infection. The testing for it is available throughout the city, but is somewhat limited, and our healthcare system remains open and available to everyone who needs it. So here's more detail on that. There are now 242 new cases of this infection confirmed in Philadelphia residents since yesterday, bringing us to a total of 1,315 total cases since the beginning of the epidemic. That 242 is an increase from 182 new cases that we reported yesterday. Of the 1,315, we know that 87 have been hospitalized and that 88 were known to be healthcare workers. I mentioned yesterday that although we have missing information on race on most of our cases, that we were seeing recently a shift towards more cases among African Americans. That's seen again today. Now, race is missing in 85% of the case reports, so I don't want to put too much emphasis on this, but I do want to drive home the point that this virus does not discriminate. Every racial group and every person in this city is at risk. We have, unfortunately, 5 new deaths to report today from the coronavirus infection, bringing us to a total of 14. I don't have demographic information on all of the 14, but of the first 12, I can tell you that one was in the age range of 40 to 49, one was in the age range of 50 to 59, 6 were in the age range of 70 to 79, 3 were in the age range of 80 to 89, and 1 was over the age of 90. Of those 12 people, 7 were residents in nursing homes. A little on testing. As I've said every day, testing is still available through most hospitals in the city. It is available through referral, not through walk-up. In general, people are testing those who have symptoms over the age of 50 or healthcare workers. The Citizens Bank Park testing site that's been available will be open today from 1 p.m. to 6 p.m., assuming it's not raining. Yesterday, the site tested 157 people. The site tests healthcare workers and people over the age of 50 with symptoms, but we want to clarify and expand a little bit the definition of healthcare workers starting today. So this includes also behavioral health workers, so people who work in clinics for mental illness or people for the clinic for substance use, as well as people who work in congregate settings, for example, homeless shelters. If those people have symptoms, they can come and be tested at that site. Let me just say again what we want to say every single day. Staying away from other people and staying home is what you're going to do. The most important thing you can do to protect yourself, protect your family members, protect your friends, and protect the rest of the people in Philadelphia. So stay home unless you absolutely have to go outside. Keep your distance from people. Wash your hands. If you are sick with this, with a fever and a cough, stay away from other people. And the symptoms to look out for you or anyone else who has this illness that says that a person needs medical care is difficulty breathing, persistent pain or pressure in the chest, confusion or inability to arouse, bluish look to the lips and face. So if any of those happens, contact your doctor or go to a hospital emergency department. The hospitals in the city right now are not overrun. There's plenty of space. The hospitals are ready to provide care with anyone who gets sick. And I want to just reemphasize what the mayor said. Everyone in Philadelphia who needs medical care for this will be able to get medical care. So don't hesitate to seek medical care if you feel you need it for this infection. More information on this illness, again, is at www.phila.gov/COVID, that's COVID. And if you have medical questions, 24/7, you can call 1-800-722-7112. Now I want to turn it over to Armando Esquerra-Hasbun, who's going to summarize my comments and the mayor's comments, and then we'll take medical questions.
Buenas tardes. El mensaje del alcalde de Filadelfia. Tristemente, anoche, en medio de la crisis provocada por esta pandemia, presenciamos otra crisis de salud pública en Filadelfia: la violencia por armas de fuego. 5 personas fueron heridas de bala, entre ellas un bebé y un niño de 14 años de edad. Esto no puede continuar. Somos mejores que esto. Es necesario dejar en claro lo siguiente: la policía está haciendo cumplir la ley. Si usted está cometiendo delitos con armas de fuego, será arrestado. Es así de sencillo. Deponga las armas o enfrente las consecuencias. La comisionada de policía Outlaw nos acompaña hoy en caso que los reporteros tengan preguntas sobre las operaciones policíacas. Ella le está ordenando a los oficiales que continúen haciendo cumplir la orden de quedarse en casa. La ciudad de Filadelfia invoca a la Fiscalía para que procese enérgicamente todos los cargos relacionados con armas de fuego durante este tiempo de crisis. Recalcamos que la ciudad de Filadelfia desea enviar un mensaje muy claro. No vamos a tomar a la ligera las armas de fuego y la violencia que generan. Este es un mensaje que el fiscal del distrito puede subrayar en su manejo de estos casos de aquí en adelante. Hay cosas que todos los habitantes de Filadelfia podemos hacer en medio de esta crisis. Si usted o alguien que conoce necesita apoyo debido a una situación de violencia potencial, comuníquese con el Programa de Intervención de Crisis Comunitaria o Community Crisis Intervention Program al 215-800-4611. Repetimos, 215-800-4611. Si usted ve algo, diga algo. Puede denunciar actividades delictivas de forma anónima comunicándose con la policía al 215-686-TIPS. Esto es 215-686-TIPS. Para los propietarios de armas de fuego respetuosos de la ley, por favor, guarde sus armas en un sitio seguro y si necesita un seguro para armas, puede comunicarse con la oficina del alguacil. Si su arma de fuego fue robada, repórtelo a la policía de inmediato. La ciudad ha estado trabajando incansablemente para detener el flujo de armas ilegales en Filadelfia. Únase a nosotros. Asegúrese de hacer oír su voz, llame a sus legisladores estatales y federales y exija reformas significativas a la tenencia de armas de fuego. Mientras tanto, debemos quedarnos en casa, lavarnos las manos y practicar el distanciamiento social. Así salvaremos vidas. En otros temas, la Oficina de Manejo de Emergencias de la ciudad, dirigida por el comisionado de bomberos Adam Teal, ha estado trabajando día tras día para obtener equipos de protección personal para nuestros bomberos, oficiales e instituciones sanitarias en la ciudad. Pero a nivel nacional, la situación de los suministros insuficientes en los hospitales ha generado muchas preocupaciones relacionadas con un posible racionamiento del cuidado médico. Nos complació ver que la Oficina de Derechos Civiles del Departamento de Salud y Servicios Sociales de los Estados Unidos acaba de emitir un boletín para garantizar que la atención médica que se brinda durante la crisis del COVID-19 permanezca libre de discriminación. El boletín les recuerda a los proveedores de salud que la discriminación en los programas financiados por el Departamento de Salud y Servicios Humanos está prohibida, y esto incluye la prestación de servicios de atención médica durante esta pandemia. Esto se refiere a cualquier tipo de discriminación por motivos de raza, color, nacionalidad, discapacidad, edad, sexo y ejercicio de conciencia y religión. La Oficina de Derechos Civiles se enfoca particularmente en asegurar que las personas con discapacidades no sean discriminadas cuando se tomen decisiones sobre su tratamiento durante esta crisis de salud. Este es un recordatorio importante para los residentes de Filadelfia y del país. No se puede discriminar a ninguna persona al momento de recibir atención médica durante esta pandemia, incluso si no tiene documentos. Ahora es el momento de dar una actualización con respecto a la materia de salud al día de hoy, 31 de marzo del 2020. La última información en materia de salud con respecto a la COVID-19 en Filadelfia. Hay un crecimiento continuo de los casos y la tendencia es que sigan aumentando rápidamente. El sistema de atención médica está disponible para todas las personas que lo necesiten, independientemente del idioma que hablen, si tienen seguro o no, o de su estatus migratorio. Desde ayer a la 1 de la tarde se han confirmado 242 casos nuevos de coronavirus en Filadelfia y actualmente tenemos un total de 1.315 casos confirmados. Los detalles que podemos compartir son los siguientes. 87 personas han sido hospitalizadas, de ellas 88 personas son trabajadores del sector salud, entre los diagnosticados. Hay casos que se reportan en toda la ciudad. En el sitio web philadelphia.gov/COVID-19 se puede encontrar un mapa donde, ubicando su código postal, se puede saber cuántos casos han sido reportados en su localidad y así también como el número de pruebas que se han realizado. Aproximadamente el 85% de estos informes no especifica la raza, pero los datos que se conocen hasta el momento sugieren de que ha habido un repunte entre las comunidades afroamericanas. Este virus no discrimina por raza o por género. Con mucha tristeza reportamos 5 nuevos fallecimientos en Filadelfia para un total de 14 personas que han muerto por la COVID-19. A continuación, los detalles sobre estas 12 primeras muertes registradas. Una persona entre los 40 y 49 años de edad, una persona entre los 50 y 59 años de edad, 6 personas entre los 70 y los 79 años de edad, 3 personas entre los 80 y 89 años de edad, una persona mayor de 90 años. Las pruebas están disponibles en la mayoría de hospitales y deben ser ordenadas por un médico primario o un médico de cabecera. Recordemos que las pruebas pueden ser aplicadas a personas que tienen síntomas, que son trabajadores del sector de la salud o que tienen más de 50 años. Respecto al centro de pruebas del Citizens Bank Park, hoy está abierto de 1 de la tarde a 6 de la tarde si el clima lo permite. Ayer se realizaron pruebas a 157 personas y se vio que los casos van en aumento. Por favor, si usted no es un empleado esencial, quédense en casa. Si debe salir, le recomendamos mantener una distancia social de 6 pies y lavarse las manos. Si usted está enfermo con fiebre o tiene problemas respiratorios, por favor manténgase lejos de otras personas. Si debe salir por alguna emergencia, use una máscara. Si presenta los siguientes síntomas, debe buscar atención médica inmediatamente. Problemas al respirar, dolor fuerte o presión en el pecho, confusión o incapacidad al momento de despertar y labios o cara que se tornen azules. Estamos preparados para atender esta emergencia médica. Le invitamos a consultar el sitio web para mayor información www.fila.gov/COVID. Recuerde usted que puede llamar al 311 si tiene preguntas sobre la COVID-19. Hay servicios de traducción disponible en 100 idiomas. Si tiene preguntas de carácter médico, también puede llamar las 24 horas del día, 7 días por semana, al 1-800-722-7112. Esta llamada es gratuita. Muchas gracias.
Okay, we are now going to move to our Q&A portion for members of the media. Please remember that we do have limited time during these briefings, and actually today, Dr. Farley does have to leave a little bit early, so that we're asking all of the health department questions be asked up front. So reporters are also asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. So for those logged in today, please use the raise your hand feature, and that can be found under the participants list. And we will unmute you one by one to answer your questions. So first we have Mike D'Onofrio with the Tribune. You are now unmuted.
Thank you. I guess for Dr. Farley, can you just please describe more this shift? You were saying more African Americans were testing positive for the virus. Can you quantify it? You know, specific places in the city? Maybe just talk about it. Had fewer African Americans gotten tests before this shift? Just kind of anything like that?
So we're working with very limited information right now. As I said, 85% of the test results, we don't have race information on it at all. And so I'm just looking at a few of the numbers where we do have race information. I can tell you that the majority of that right now is African American. I hope to have a more complete analysis of the case investigation forms, which is what we do after we get an initial test result, that has more information on race. I hope to have that ready for you tomorrow. I can't tell you that now, but I can say, just based on the little information I'm seeing right now, I'm going to get a clear message to the African American community in Philadelphia that you are clearly at risk and you need to be very serious about the social distancing and our other recommendations.
And then, are you seeing any? I did see the map on the city's website about where people are testing positive. But are you seeing any hot spots for the virus in the city? You know, I did see some zip codes in South and Southwest Philadelphia, but are you seeing any others throughout the city, or explain why those places have higher, confirmed cases?
At this point, we don't have enough tests in each zip code to be able to say with confidence that maps really tell us where the virus is and isn't. I think all we can conclude from that is that the virus is in every neighborhood in Philadelphia, and everybody needs to take it seriously. As we have more testing done in a week or 2 weeks from now, we may have a better sense of case rates by zip code, and then we may change that map, and it'll be more informative.
All right. And then maybe just lastly, can you kind of grade how Philadelphians are doing with social distancing? I mean, are you maybe recommending any additional measures to maybe clamp down on social gatherings too?
I only have anecdotal information that from the time I've been out, it seems that the vast majority of people are following our recommendations. There aren't many people outside, and those that I do see outside are keeping a distance. When I've gone to the grocery store, I notice that people keep a distance from each other. The grocery store limits the number of people who are in the store at a time, and people are queuing up with big spaces between them before they get into the store. So I've been pleased with the vast majority of Philadelphians and what they're doing. There are some steps that the mayor's talked about before that we may need to do for the few percentage of people that are out that you see who are not following recommendations. But overall, I'm pleased with what people are doing. My main message is we just need to keep it up.
All right, thanks.
Okay, thanks, Mike. And now we will go to Sean Walsh with the Inquirer. You are now unmuted.
Thanks very much. Commissioner Teal on Friday said he didn't know when the city's order of 500,000 masks would arrive. Can you update us on that and the arrival of PPEs in general?
We are still tracking that shipment. Last we had heard it was still overseas, but we are pursuing a number of different options around personal protective equipment and trying to expedite getting that equipment into Philadelphia. But I don't have an update of exactly when that would be.
Okay, still hasn't arrived, sounds like. Gotcha. If Commissioner Outlaw is there or the mayor, can you update us on the...
Sean, just to interrupt, I want to remind everyone that Commissioner Farley has only a short period of time, so I want to make sure that we're focusing on health questions for the commissioner, so he can leave and do his important business, and then we'll come back to Commissioner Outlaw, myself, and the mayor.
Sure, you can come back to me that mine are not health related.
Okay, Sean, we'll come back to you. Next, we are going to go to Martin Pratt at YBN Philly.
You can come back to me because mine are not health related also.
Okay, for reporters that are logged in, if you want to lower your hands if you do not have a healthcare related question at this point, and we will go to those who have a healthcare related question. Thank you. Next, we have Jeff Cole with Fox 29.
I was just about to lower my hand. I only have questions for the mayor and Commissioner Outlaw.
Okay, we will come back to you. We're going to Mitch Blocker with NBC 10.
Thank you, Commissioner. If an essential city worker tests positive for COVID-19, can you describe the process for quarantine and notifying employees that they came in contact with?
Yeah, so if we have had city employees who have tested positive, and if employees are tested positive, then the health department contacts the employee, interviews the employee about who else that employee had come in contact with, and then based on the information they get, those employees or other people, not all of them are employees, are put into categories of high, medium, and low risk. And high and medium risk are asked to go into quarantine for 14 days. The low risk people are asked to monitor for symptoms. And the employer, in this case the agency, is likewise notified so that anybody who needed the information can get it, and that appropriate cleaning is done in the workplace.
How long does it take to notify workers who they may have come in contact with?
And that's going to vary. Some people may be harder to reach than others.
And can you tell us how many, in particular, city workers have had to be quarantined?
No, we don't keep track of how many of them are in quarantine.
And for police officers or first responders or firefighters, is the process any different for them?
No, it's the same process.
Thank you, sir.
Okay. Next, we have Laura McChrystal with the Inquirer.
Hi, a question for Dr. Farley about the test sites. We've heard from people who don't have cars that they're having trouble getting tested because the sites are drive-through. Is there any site that you know of at this point that is available for walk-ups?
I think there are a number of sites that are available as walk-ups or even within a facility. And the first place that anybody should do is go to their primary care physician if they have that, or if not, a health system that they've been seen before and can get tested by referral. The vast majority of those are available through, you don't need to drive in.
Okay. And the city's access to testing, you know, you mentioned that it's limited because the testing materials are limited. Do you know at this point, like, how many of those test kits the city actually has access to, and what are you doing to try to increase that availability?
The swabs that we use for collecting the samples are purchased by many people, not just the city. So each hospital is out there collecting or purchasing swabs, and the city is. The health department now has some in the thousands, 2,000, 3,000, 4,000. We go through them fairly quickly, and I don't know how many the other systems have, but all of them are not enough, and we feel like we could be doing more testing if we had more swabs. But you know, we also have the limits on how many tests the laboratories can do, and we have limits on personal protective equipment. So all three of those need to get better for us to substantially ramp up testing.
Okay. And lastly, is the city still looking to add more surge hospital space beyond the Leah Corris Center that was already set up? And in the existing hospitals, do you know whether, you had mentioned, I think a couple weeks ago now, that they could be adding beds within existing hospitals. Has that been done?
Yeah, the first step is to try to reduce the demand on the healthcare system, and that's what the social distancing is about. The second step is for hospitals to add beds in their existing facilities. It's much easier for them to provide that care there than an entirely new facility. And I've spoken to all the major health systems in the city. They're all looking at options for how they can do that, and there could be a substantial increase in beds just by expanding into existing facilities. And then the third option is what we have at the Leah Corris Center, which is 250 beds. We hope we never get to that point and don't need that, but if we do, we want to have that be available. If we do all of those steps, we think it's unlikely we'll need more than that, but we're going to watch this closely.
Thank you.
Okay, thank you. We're going to Mayor Rindy with WHYY. You are now unmuted.
Hi, I wanted to ask about the zip code map of cases. Why did you put that map out, and is that informing the city's strategies at all?
We put that out because we think the more information that everybody has in this, the better off they are. It is not changing what we're doing in general at this point. The main message is it's in every neighborhood. If it was only in one neighborhood, then that might change our strategy, but it's telling us that it's all across the city. So we are trying to have all the services and activities we're doing be citywide.
There are some areas where people have been seen congregating outdoors and not social distancing all the time. Is that a problem at all? Are there any public health strategies that you're using or that could be used to encourage people?
Well, we want to have everybody following our rules that say stay inside and stay away from people. There are some people out there visible who are coming in contact with each other. I don't think that's a large percentage of the population. We want it to be 0%. There are steps that we're taking, such as reinforcing the message every time we can, and as what you heard yesterday, Mr. Abernathy said, taking down basketball hoops, for example, so as to not encourage people to be playing basketball and come in contact with each other there.
City Council has some funding to do messaging. I don't know if you're part of that effort, but I don't know if there's anything more that can be done in that way.
I can just simply say that I've had conversations with the council president, and he said, how can they be helpful? And I said, the social distancing messaging can't be said often enough. Please use whatever opportunities you can to reinforce that message.
Great, thank you.
Okay, thank you. Now we are going to Pat Loeb at KYW. You are now unmuted. Pat, can you hear us? Okay. All right, Pat, we'll come back to you, or if you want to type your question in the chat box, we can ask it for you. Okay, it looks like we have a couple more questions. I'm going to go to Alicia Reed at CBS 3. You are now unmuted.
Thanks. My question is about the SEPTA workers. With the new positive cases that we heard about over the weekend, a lot of workers are concerned about additional precautions when it comes to driver protections. Are there concerns being addressed as far as making sure their health is being considered?
I think I'm going to have to refer you to SEPTA for that. I don't know exactly what changes in policy they may be doing, so I can't answer that question right now.
Okay. Is SEPTA here today, or is SEPTA here?
No, SEPTA is not here today.
Okay. Did you have anything else, Alicia?
No, that was it. It was about the health of operators on SEPTA.
Okay. I'm going to go back to Pat Loeb. Try to unmute you here, Pat. You can go ahead. I do have Pat's question here, so I'll go ahead and read it. Her question is, it's 3 weeks since the first case, and we're up to a little over 1,300. Is this a long enough trajectory to establish whether social distancing is working to flatten the curve?
Yeah, I would count the day zero of social distancing right around 2 weeks ago. That was the day that we had the closing the businesses, and that really the stay-at-home messaging became very clear. And 2 weeks is not enough time to see what the impact of that is. We're going to be watching this closely, but it's too early to say.
Okay, I think that's the end of our healthcare questions at this point. We're going to go back to Sean Walsh at the Inquirer.
Yep. And Kelly, I'm sorry, Commissioner Outlaw has informed me that she also has a tight time frame as well. So if we could focus on the questions for police, would be appreciated.
Okay, you got
Great,
it.
thank you.
Sean, you are unmuted.
Thank you. For the commissioner then, are there any updates on the investigation into the shooting, a motive or suspects?
Unfortunately, good afternoon. Unfortunately, there's been a lot of shootings over the last few days. To which one are you referring?
Sure, I'm talking about the one on West Herald Street last night, sorry.
So last night, our investigators are actively working. We are following as many leads as we have, gathering evidence. Obviously, this just happened late last night, early this morning. But I can assure you that we are actively looking into last night's incident. Okay, no specific updates though? No.
And for the mayor, with your comments on the shooting earlier, you talked about the messaging the district attorney can provide on gun violence. Can you be more specific there? What is there gun cases that are not being prosecuted now that ought to be?
Well, there are people that they've either had a prior conviction or getting caught with a illegal weapon that seem to find their way out of the jail. And in this particular, anytime that's a problem, but in this particular pandemic, it's even a worse problem that we're dealing with. Our officers are on the street valiantly putting their lives in harm's way to take guns after gun after gun off the street, and it seems that the same characters wind up back on the street with another gun. I understand the issue, and look, I would not be considered a staunch conservative by any stretch of the imagination, and worked very hard over the last 4+ years to reduce our prison population and come up with criminal justice reform measures that make sense. But in this particular situation, we have people out there who are walking around with illegal guns. Our people are arresting them and taking the gun, and they seem to find their way in the process back out in the street, and that's not acceptable.
And that's something that the district attorney could help fix with the change in policy.
Well, it's like law and order. The police make the arrest, and then the prosecutors prosecute the case, and that's where we seem to have a problem.
Okay, thanks. This, I'm not sure if this is for Brian or Dr. Farley, but Last week, City Council was told that the estimated need for masks is 10,000 to 30,000. Does that include just the city's need, or does that also include hospitals that are in the city?
I would expect, so we're going to need more than 30,000 for the city as a whole, including hospitals, first responders, and other staff. So I don't recall that that information coming from the administration. So I'm not sure exactly where that information came from, but we are actively pursuing any N95 masks that we can possibly get our hands on.
Okay, and to that end, lastly, I believe it was you, but I forget who at the press conference recently mentioned that the city got 9,500 masks from the Strategic National Stockpile, but I believe you indicated that they were expired. Does that mean that they won't be used, or will they be used anyway?
They were expired and they had dry rot, and so no, we won't be using any masks that had dry rot.
Got it. Okay, that's all I have. Thank you.
And to be clear, we understand that there are additional shipments coming in from FEMA, and are optimistic that those masks will be in better situation.
And do you have a timing estimate for that?
I don't offhand. We're optimistic this week, but I don't know exactly how many or when they'll drop.
Thank you.
All right, next we have Jacqueline Lee with Action News. You are unmuted. I think you might have to unmute yourself.
Oh, what about now?
There you go.
There we go. All right, thank you. Dr. Farley, can you confirm, so are you saying you guys do not track the number of positive and quarantined first responders?
So Dr. Farley has left. Again, we had indicated that questions for him needed to be up front. I can say that the city's posture has been for the last 2 weeks that we will not confirm how many cases the first responders or city employees have, what departments they are in, and what facilities they will be in. That posture has not changed.
Can you explain why? Because I mean, these individuals are interacting with the public on a daily basis, and every other major U.S. city has released these numbers.
Our concern is that we want to make sure that one, the privacy is protected, but also that we don't create some level of panic by saying, 12 officers or 50 officers or 100 officers have been tested positive. We are taking every precaution to make sure that our public is protected. That's our top priority, and we will continue to do tracing of any individual that has had contact with anyone who has tested positive to make sure that those individuals are taking appropriate steps.
Okay, thank you. Are the departments hurting from people who either have had to go into self-quarantine or who have tested positive? Like there's a lack of responders at all then as a result?
No, we have not had any issues with staffing police, fire, or our correctional officers at this point.
Okay, and then Commissioner Outlaw, how is the police department preventing the spread throughout, the department?
Well, I can't answer that definitively, but we have several protocols in place, the tiered approach. One, keeping in mind that we have to conserve the equipment that we do in fact have, but we sent out very specific protocols depending on the type of call that we're responding to, whether it's in response to a call or it's proactively a self-initiated call, but it all includes reinforcing the need for social distancing, even having people step outside of their homes when we're responding to calls, making sure we use the equipment that we do have for certain types of calls, and again, we reinforce time and time again the need to wash hands or use of hand sanitizer when gloves aren't necessarily appropriate to use at that time.
Okay, and lastly, will the city consider it a line of duty death if a first responder dies from COVID-19?
We're looking into workman's comp and the like, but in reality, the majority of our staff that has been infected, if not all, would have received it through some sort of community interaction. We're taking every step necessary to keep our officers, our firefighters, our correctional officers, our healthcare workers safe to the best of our ability given the circumstances, and we're going to continue to do that.
Okay, thank you.
Okay, next we have Denise Clay with The Sun.
Hi. My initial question I was going to ask Dr. Farley, but he's not here. So I guess I'll ask my question of Commissioner Outlaw. There have been a number of cities and towns where people have been arrested for participating in large gatherings. Most recently, there was a minister in Hillsborough County, Florida, that was arrested for having not one but 2 large church services. Is arresting people for violating the stay-at-home guidelines off the table? And if it is, what do you do? What can you do to, get people to understand that no, you have to, have fewer people in a bigger space?
I think that's a really good question. Right now, we are really working within uncharted territory. Arrest is not off the table, but obviously, given that this is a public health issue, we want to make sure that we don't interject in situations that will put either our officers or the citizens that we're providing the service to at more risk, making situations worse than what they are. Officers certainly have discretion. We're all familiar with some people that have been out and about very blatantly in disregard to the stay-at-home order. But again, we have to deal with these on a case-by-case basis, especially in light of the capacity issues with courts closing down. And we want to make sure that we don't contribute to a bottleneck further on down the road with limited staffing and resources and equipment later on down the road.
Okay. Now, I know that there's probably been a downturn in certain kinds of crime, like, burglaries and shoplifting stuff, because things haven't been open. But, there was a shooting last night, and you said that there's been more than one shooting since the quarantine order went into effect. Are those kind of is that going up? Does that represent a change at all, or is that kind of what it was before we all went into quarantine?
You're right, we are experiencing a downtrend in all of the other crimes. But with that said, we've experienced an increase or a spike in shootings, but this spike has been occurring actually since 2017. So I don't necessarily want to attribute that to what's going on right now with the virus, so to speak. But with all of that said, again, we will continue to do what we've been doing, making sure that there's strong police investigations, visible presence, which we've heightened, making sure that we will continue to provide service the way it's expected.
Okay, thank you.
You're welcome.
Thanks, Denise. We are now going to go to Jeff Cole at Box 29. You are now unmuted.
Thank you. Back to Mayor Kenney. Mayor, you've now just said that the DA in this city is not prosecuting people who have gun crimes. Have you spoken to him about it? And is it your belief he's endangering the public with that policy?
His office is aware of our concerns, and we've expressed them and expressed them again. It is what it is. So,
well, it's a city with tremendous violence and with problems with gun crime. You've obviously talked about that. What has he said to you when you said you're not prosecuting people with gun offenses?
Well, a lot of this conversation is going on with our criminal justice partners, and he would have to speak for himself. I'm not speaking for him. And the other thing I think is important for people to know, he's an independent elected official. We did not appoint the DA. He's independently elected and is a separate office. So he would have to speak for himself.
Well, Mayor, do you believe the DA is endangering the public by not prosecuting gun cases?
We need more people who are carrying guns on the street illegally and are carrying guns with a record to be segregated from the community, because that's the reason why our shooting spike has happened, and the reason why our homicide spike has happened.
And the district attorney is failing to do that.
That's your words.
But do you believe the district attorney
I believe
is failing
something needs to be done. I believe something needs to be done differently in what we're doing. People do not believe that there is a consequence for carrying an illegal gun, and we need to change that mindset.
And that's the responsibility of the district attorney in your view?
It's responsibility for all the criminal justice partners working together to get that done and to keep people safe.
I have a question for Commissioner Outlaw, please. Commissioner Outlaw, how is what Mayor Kenney now says is the failure to prosecute gun criminals, how is that impacting what you're doing in this city?
There has to be teeth. There needs to be consequences. we can't see a revolving door. If people are released from incarceration, we need to make sure that there's strong supervision or programs aligned with them. But at the same time, there has to be teeth. Bottom line, I think the mayor said it pretty well, in that when I go out to commit a crime, I need to know what the consequences with certainty are going to be.
So have you heard?
Hey Jeff, I just want to clarify something that the mayor said as well. We're not saying that the district attorney isn't prosecuting gun crimes. In fact, he is prosecuting gun crimes. I think we are concerned about the final disposition of those cases, which we have said to him, and whether individuals are receiving bail as they await for trial, especially in this current climate. We recognize the need for us to keep the prison population low, but we also recognize the need to keep folks who are causing harm to our communities segregated from those communities. So I don't want to give the impression that the district attorney isn't prosecuting. He is, but I think we have a number of questions about where people end up and how they're segregated from the community around guns specifically. Sorry for interrupting.
I'm sorry. I have one more question, if I could. I'm sorry, Brian. The quote from the mayor is, "We call on the district attorney to vigorously enforce gun cases." He, in fact, did say or did imply that he does not believe that the district attorney is vigorously enforcing gun cases. Please speak to that.
And my point, Jeff, was that enforcement is not just about prosecution. Enforcement certainly includes law enforcement, and so the arrest. It includes how the cases are disposed, how they're charged, and not just about whether they are prosecuted or not. The prosecution of cases is a wide array and a wide gamut that I am not going to get into a level of detail now, but I do want to make sure that that we are having the right discussion around this issue, and it's not about charging. The district attorney will say, and will say rightfully, that he is charging gun crimes. The question is at what level he is charging, whether those charges are maintained throughout the process, and whether people are confined as they await trial for gun crimes.
Thank you.
Thank you.
Okay, now we are going to Dale Mazzacappa with the notebook. You are now unmuted.
Hi. So as you know, the school district is distributing Chromebooks for students to get, and has a goal of universal online learning by April 20th, but there are still many households that don't have internet access in the city. A, do you have any estimates on that? And B, can you tell us what steps the city and district are taking to increase that? Do you have goals for doing that? Any deadlines? And are there any safe alternatives now for people who don't have access to them?
So we are currently working through these issues with the school district. The first step is the distribution of Chromebooks. I think we have already outlined a number of opportunities to have online access, but we recognize that those aren't going to be fail-safe for everyone, and so we're going to continue to work through that, but I don't have those details today, and certainly we'll see if we can provide those details working with the school district. I just want to... I do just want to say Commissioner Outlaw had a time crunch, and I just want to make sure that we, if there are any additional questions for the Commissioner, that we get them in before she has to leave imminently. I'm sorry, Dale, to interrupt. All right. Go ahead, Dale. Sorry.
No problem. I'm sorry. I should have said that I didn't have a law enforcement question. Can you just repeat what you just said about that there's a few steps that you've already taken, and that could you give us a deadline for when you might tell us what might be happening now and what else you're doing?
Sure. I think we can provide additional detail this afternoon on what we've done and what the distribution plan looks like. There's been a lot of work. I'm not privy to all the details as I stand here today.
But I'm talking specifically about internet access, connectivity for families, as opposed
yes,
to
Dale, I understand. Again, we rolled out with Comcast and Verizon a number of what they are doing to provide internet access, and we will certainly continue that engagement and can have that conversation this afternoon.
All right, thank you.
Okay, we do have two more questions for Commissioner Outlaw. I am going to unmute Mike D'Onofrio of the Tribune.
So Mike, I'm going to apologize. She just left, but I will do my best to answer questions for you.
I was going to ask, how many police officers have called out sick today, or what are your most recent figures, and are you seeing an uptick in call-outs compared to what you could typically expect before the pandemic came to this?
Sure. So no, we've actually not seen an uptick in call-outs for police or fire or our correctional officers. Our sick leave usage is roughly the same as it was prior to the pandemic.
All right, that's all I got.
Great.
Okay. We also have Mitch, I think, had a question as well for the Commissioner. Mitch, if you want to go ahead and ask that.
Yeah, I appreciate that. I was curious if there are any limitations on the number of officers who can be together at one time.
They have taken appropriate social distancing opportunities and roll call, and their certainly in their districts and in their patrols. Clearly, there's going to be times when they have to be grouped together, but I think we're taking every step possible to make sure that officers are also observing the social distancing guidelines that we've provided.
And one other question about crime and guns. Gun permitting applications and the lines from gun stores when they were open were up significantly. Is that concerning? Do you think that's contributing to any of the weapons that are out there currently that have been in any of the crimes that you've seen?
Yeah, we don't know that. We do see the lines, and I don't think it's an essential business, but that's not my call. We do have concerns about more guns proliferating in the community. I would suspect that a lot of those people are law-abiding citizens, and because of our lax rules in the state, some of them could be straw purchases for people who can't legally buy a gun themselves. So yeah, I do have concern about the more guns in our society, the more guns in our city, the more problems we have.
Thank you.
Okay, thanks, Mitch. We just have one other question that was for the Commissioner from Max Marin. You are unmuted now.
Hi, Brian, you can do this. Thanks for your time. I just wanted a clarification. The Commissioner had said earlier that arrests are off the table, and under the city's stay-at-home order, are officers justified to make the vehicle and pedestrian stops solely to check if civilians are complying with the rules?
No. So the police protocols are not to use social distancing as a reason for a pedestrian stop. They still need probable cause for a pedestrian stop.
And one follow-up.
Suspicion. Appropriate suspicion for a pedestrian stop.
And has the Commissioner told you about any areas where social distancing has been a severe problem geographically in the city? Is there an area in particular where the rules are just being flouted more than in other areas?
Sure, and I wouldn't necessarily say this is flouting the rules. We have a significant issue in Kensington, not surprisingly.
Yes.
And it's one that we recognize, and I believe that we're going to need different tactics to tackle the challenges in Kensington than simply warning folks or even issuing citations. We're going to need to provide very specific locations for people to go, as well as making sure that those areas that they do go also practice appropriate social distancing. I think we recognize the challenges we have in that community and are continue to be focused on those challenges as well.
What are the officers doing specifically in Kensington right now?
So we are developing that plan, Max. It's a fair question, but I can't answer it today. And frankly, I don't think what we have done to date has been successful. So we're relooking at our tactics and hope to provide a new tactic in the near future.
Okay, thanks, Ryan.
Mm-hmm.
Okay, we are going to go to and the queue.
Ryan, ¿puedes repetir la pregunta, por favor?
Sí, han habido varios tiroteos. Esta pregunta era para la comisionada que se acaba de ir, pero no sé si me pueden ayudar a responderla. Queremos tener algo en español. Han habido varios tiroteos, uno de los más violentos anoche, con personas congregadas para celebrar un cumpleaños. Obviamente no estaban siguiendo la orden de quedarse en casa, estaban ignorando la práctica del distanciamiento social. En luz de estos crímenes, queremos saber detalles específicos de lo que la policía está haciendo y si ahora tienen pensado en arrestar o dar multas a personas que no obedezcan esta orden y esta práctica.
Te repito, estás preguntando con respecto al tiroteo de anoche, que fue en un cumpleaños, y hubieron 7 personas, y si se cumplía la orden de distanciamiento social, y tu pregunta era para la comisionada, si hay detalles con respecto a políticas, con respecto a arrestar gente que no esté cumpliendo con el distanciamiento social.
Sí, de arrestar o dar multas a estas personas.
¿Perdón?
De arrestar o dar multas a estas personas.
Okay, bien. So the question has to do with the shooting last night that involved 7 people, and is there any information
5
about
people.
whether they were keeping social distancing, and if there are any details from the commissioner or the administration in regards to arresting or issuing tickets to people who are not complying with social distancing?
Sure. So the individuals involved last night were not practicing social distancing. They had, in fact, been issued warnings to disperse. They did not do that, and officers have discretion to issue tickets when appropriate.
Efectivamente, los individuos involucrados en el tiroteo de anoche no estaban observando las normas de distanciamiento social. Se les dio advertencia para que se dispersaran, no lo hicieron, y los oficiales tuvieron la discreción de emitirles papeletas.
¿Estas son como infracciones o qué es lo que...?
The citations carry infractions, or what do they entail?
So they are code violation notices, which carry a fine, and in this case, the citation would likely be either failure to disperse or disorderly conduct. I do not know how much the fine would be.
Pese a que no sabemos el monto de estas citaciones conllevan una multa. Los cargos específicamente son de no cumplir con una orden de dispersamiento o de conducta indebida en público, pero no sabemos cuánto es el monto de la multa en estos tickets.
¿Y esto es algo que se va a practicar con otros que no estén obedeciendo la orden de quedarse en casa o de practicar el distanciamiento social de ahora en adelante?
¿Puedes repetir la primera parte de tu pregunta, Brian?
¿Y esto es algo que se va a practicar de ahora en adelante con otras personas que no estén obedeciendo la orden de quedarse en casa o de congregarse afuera o adentro?
Es decir, emitir una papeleta.
Sí.
Bien. Is this a policy that's going to be continued with other people that are not complying with the distancing regulations that is issuing the tickets?
Yes. So I think we'll continue to warn residents that are not complying with the social distancing rules that we've put forward, and should the officer feel it necessary, they could issue a citation. Again, officers have broad discretion in this regard.
Vamos a continuar dando las advertencias a los individuos que no estén cumpliendo con las órdenes de dispersamiento para mantener la distancia social, pero recordamos que los oficiales de policía cuentan con discreción para proceder ulteriormente y poder multar a las personas si así lo ven conveniente.
Y Armando, una última pregunta, one last question. Esta mañana estábamos en Kensington y hay muchos indigentes en la calle. Sabemos que hay distribuciones de comida en diferentes lugares de Kensington. Había filas afuera de gente, básicamente, no practicaban esa distancia. ¿Qué está haciendo la ciudad para proteger no solamente a ellos, sino a los residentes del área?
Tu pregunta es que en el área de Kensington se observó por la mañana a grupos de servicios comunitarios o personas que asisten a estos servicios que no estaban manteniendo la distancia social, y qué es lo que se está haciendo o se va a hacer para proteger a estas personas y a los residentes del área.
Sí, correcto.
This morning, several inhabitants and residents in Kensington area were observed accessing social services and community services, not keeping with the rules for social distancing. What is going to be done to protect these people and residents of the area as well?
We recognize that the challenges in Kensington present a special or specific challenge to us, and we'll need new tactics to encourage social distancing in the community, and we'll be continuing to work with our social service providers to encourage social distancing in that community as well. What has worked in other communities is the issues in Kensington specifically mean we need new tactics, and we are currently developing what that plan will look like.
Reconocemos que existen retos para poder lograr que las personas en el área de Kensington puedan cumplir con el distanciamiento social, pero al mismo tiempo reconocemos que estos retos son específicos y estamos viendo qué se puede hacer con los proveedores de servicios sociales para poder implementar nuevas reglas y nuevas tácticas en la comunidad, viendo lo que ha funcionado en otros lugares, para poder desarrollar un plan para poder hacer cumplir el distanciamiento social.
Thank you.
Thank you.
Okay, we are coming to the end here. We have Martin Pratt with YBN Philly. You are now unmuted.
Thanks for doing this. Two questions, mainly for the director's office. One is based on April 3rd, I believe was the date that a moratorium was given for evictions. Will that be extended?
We are in conversations with the courts on what their operations will be going forward. We are also finalizing the city's posture. I think once the city makes an announcement, the courts will soon follow, is my understanding anyway.
Can we expect that announcement this week?
Yes, our hope is to make that announcement soon.
Excellent. And the second question is based on the protest yesterday. Wondering, do you have a statement or have you received the recommendations for reducing the prison population that the Defenders Association and also the DA's office put forth?
Sure. I'm going, so the question around, are we going to create a kind of one order to release multiple inmates at the same time? I think the courts have been pretty clear that they want to consider each case individually. They last Friday issued an order to consider certain petitions priority and emergency, so that those petitions could move forward to release inmates on an expedited basis, and appreciate the court's partnership and willingness to partner with us on this regard. I think similar to the mayor's comments earlier, I think some prudence in how we are approaching this is also appropriate. We are trying to balance, on one hand, the needs to protect our inmates and our correctional officers, but also protect the needs of the community, and balance both at the same time. I believe we have a excellent dialogue with the courts, so that we can hit the concerns that the protesters had yesterday. We share those same concerns, but we also want to make sure that we're smart about it, and not releasing someone that shouldn't be released into our communities.
Thank you.
I mean, it's important to recognize that over the last 3-4 plus years, we've reduced our prison population by about 40%. So it's not that we're against reducing our prison population. But the court is an integral part of this process, and no mayor can unilaterally make that order, and the court needs to be involved. The court placed the people there in the first place under a judge's order, and the judge's order is needed to release. So you can't just cut the judicial process out and say go do this because we told you to. The courts are an integral part of that process.
Thank you.
Okay, our final question is from Jake Bloomgard. Jake, thanks for your patience.
Yep, no problem. So I just had a quick question. I saw the rent freeze legislation that a few state reps dropped yesterday. And I've been talking to some lawyers who are kind of saying that they thought most of this authority kind of like rested more on the state and the federal level. But I was wondering if there's any kind of authority that the city has over this kind of thing, and in general, kind of how you guys were feeling about that bill that was introduced yesterday.
I don't really have an opinion at this moment because I haven't read the bill. We'll take a look at the bill and maybe have some idea for you next time we meet.
Got it. Thank you.
Okay, that concludes today's daily briefing. Thank you.
Sir.